The European Union is fully committed to developing the universal healthcare system in the Philippines. Universal healthcare provides a safety net for families so that in case of illnesses, catastrophic illnesses also, they have a system that helps them to overcome that temporary difficulty. It also provides a financial support so people can avoid getting into debt traps, but they can, after the illness and they have recovered, they can contribute as normal citizens in the society. That support has been mainly in the form of budget support, which is funded through the Treasury and through that to the Department of Health. And thereby, definition, it is fully compatible with the development goals of the Philippine government and the Department of Health. We have had excellent cooperation with the Department of Health through the decade. They have been very forthcoming and very understanding, and it has been a pleasure to work with them.
We appreciate the substantive support of the European Union to the Department of Health's mission to achieve universal health care. We look forward to strengthen our partnership with the EU in providing better health outcomes to all Filipinos, making them healthy and productive citizens as well.
The European Union assisted the Northern Samar provincial government in setting up its service delivery network in 2018.
In North Samar, we developed materials for local government and communities on how to access benefits of PhilHealth through service delivery networks. We focused on hard-to-reach areas and local government hospitals to improve quality and responsiveness of health services for the poor, especially women and children. Our analysis of regulatory policies, clinical practices, and patient flow dynamics will ultimately enable hospitals to serve patients better. We also enhanced the capacity of the Department of Health to regulate areas as diverse as health technology assessment, health impact assessment, and regulatory impact assessments.
May kababayan, mga Nortehanon, na magkaroon ng smooth delivery of health services. At least it will complement our own program of seeing to it na mga Nortehanon, especially yung mga nakatira sa sinasabing GIDA or geographically isolated areas, hard to reach area, na kung saan nahihirapan yung mga kababayan namin doon na nakatira doon to come to the health facilities like our provincial hospital, especially yung mga island towns. Well, not only island towns, mga barangay na inaccessible pa by road. So
we have the core group in the province, and we have identified 3 top challenges which I believe SDN can address or can help us address these challenges. And these are one, high maternal death, malnutrition in some municipalities, and the inadequate or lack of medicines, drugs, and supplies in our hospitals. Because we have partners like DOH and the EU that has helped us in trying to establish our SDN in the province. So with that, we have already conducted 3 workshops, and we will be, I think, conducting another one comes August. And with these workshops, we were able to invite our stakeholders from the municipal level as well as at the barangay itself, sa community mismo. Yung
pasyente po natin agad ma-identify, agad mabibigyan ng referral, and maiiwasan yung mga unnecessary expenses.
Marami kaming geographically isolated barangays. So kung mabigyan ito ng magandang serbisyo, ma-address yung needs ng community, ma-strengthen yung primary health care. We're hoping na maganda yung health outcomes sa Northern Samar.